Greetings, everybody. I hope you're keeping safe and you're staying safe during this period of COVID-19. Please remember to keep all the hygienic measures in place and remember to have social distance so that we can be able to help manage this situation. I want to welcome you in today's class, and today we want to look at thought disorders, that is schizophrenia and other psychotic disorders. I am your presenter, Caroline Ayuya from Daystar University. By the end of this lesson, you should be able to define schizophrenia, you should be able to define psychosis, you should be able to differentiate positive and negative symptoms of schizophrenia, you should be able to list the types of schizophrenia and their symptoms, and be able to classify other psychotic disorders. And finally, and not least, you should be able to understand treatment of these disorders. Schizophrenia has been a word that has been used in many settings differently. A lot of people have labeled individuals with schizophrenia as people who are insane, people who are crazy, people who are mad. Very quite heavy labeling on individuals who have or present with this condition. However, schizophrenia is just like every other mental disorder and every other illness that affect the individual in the way they function, in the way they perceive, in the way they think, amongst many other ways. Just like other many mental disorders do affect an individual. When we talk about schizophrenia, we're looking at a condition, a mental condition in which a person has a broad symptoms that disturb this person in the way they think, in the way they perceive, in their emotions, in their speech and behavior. For example, when we say that the person is disturbed in the way they think, a person can present with delusions. For example, delusions where they believe they have this supernatural power, etc. Perception has to do with the way they use their senses to be able to interact with the environment. For example, they can have hallucinations, and I give an example of an auditory hallucination, hearing voices. Their speech may be rushing the speech, amongst others. Emotions could be the way they present their emotions. For example, such a kind of a person could be in a place where there is a sad mood. So you expect them to be able to show emotions that identify with the situation, but they could present with the opposite emotions. For example, they are laughing, they are giggling, amongst others. And behaviors, just in the way they present themselves, finding that someone just sitting and in one position for a long period of time, doing nothing. So this is what is called schizophrenia. And schizophrenia is basically an illness of the brain. And that's why it's affecting this person in a spectrum of various ways. For example, in their thinking, in their perception, speech, emotions, and behavior. We will let us see what positive and negative symptoms are, but for you as a clinician to be able to diagnose someone with schizophrenia, they at least require to have more positive, negative, or disorganized symptoms that have been in this individual for about 1 month. Let's continue unraveling what is positive or negative. So we're saying at least 2 or more positive symptoms. It can't just be 1. 2 or more positive symptoms, negative symptoms, or disorganized symptoms that this individual has been having them for at least 1 month. Schizophrenia affects at least 1% of the population, and it's a condition that basically is managed. Once patients or clients who've been diagnosed with schizophrenia are able to understand this condition, the most important way is managing it. It is rare to say you can treat completely schizophrenia. I'm not saying that it is not possible, but it is rare. So management is the most common way of handling schizophrenia. And that's why we're going to see the combination of treatment is going to involve the family, the support system to help the patient or the client be able to manage these symptoms. So let's look at some of the clinical descriptions and symptoms and subtypes of schizophrenia. Now, clients with schizophrenia usually present with psychotic behavior. What do you mean by psychotic behavior? We just mean unusual behavior that has or is characterized by hallucinations, delusions, and loss of contact with reality. So, what do we mean psychotic behavior? Hallucinations could include auditory hallucinations, and we're going to look at them in a broader perspective. And delusions could be delusions of grandeur, and loss of contact with reality in terms of like they can't understand what is happening around them, derealization. So let's look at this again. We're going to narrow them down. So one of the main category of symptoms is a psychotic behavior. Another one, clinical description, is the positive symptoms, and we're going to look at what were the positive symptoms, but the clients or the patients with schizophrenia will manifest with delusions and hallucinations, and we're going to look at them. They also present with clinical descriptions of negative symptoms, and usually we mean that this client has a deficit in the normal behavior. They present with avolition, alogia, hedonia, affective flattening. And again, we're going to look at this on individual basis. And finally, and not least, they present with disorganized symptoms. For example, rambling speech, erratic behavior, inappropriate affect. Now, what do we mean by positive symptoms and negative symptoms? It will be good to make this differentiation at this point so that when we now look at positive symptoms, we understand what it means, and when we talk about negative symptoms, we know what it is. Of course, the terms positive and negative can really be misleading. They sound like judgments, as if the symptoms are good if they are positive, and then they are bad if they are negative. I guess this is what may have been crossing your mind, that they look like judgment. Positive means good symptoms, and negative means bad symptoms. This isn't the case. However, when we talk about positive symptoms, we are referring to the characteristics that add to someone's state of being. The state of being is the normal state of being, but then this person has these extraordinary symptoms that are out of that being. So they add, for example, hallucinations, delusions. It is normal for you to talk to yourself. It is normal for you to hear something and thought it's a voice, but then when it's now beyond the usual just hearing and you're talking and responding, it is adding to your being. So positive symptoms add to the state of the being of someone. Negative symptoms, on the other hand, in contrast, is that they're just characteristics that are removed from the state of being. For example, when you go to some place where a relative or a friend has passed on, the mood is always somber and everybody is sad. But then this is the state of being. It is expected that that's how we'll present ourselves. But then this individual will go there, or this client will go there, and then be able to do something different. For example, they are laughing, or they lack emotions completely. They are not really bothered, amongst others. So positive symptoms just mean those characteristics that are added to someone's state of being, and negative, in contrast, are those that are removed from the state of someone's being. And of course, we've given some of those positive symptoms. We're going to look at them, and one is definitely delusions. And we'll talk about delusions. What do we mean by delusions? Delusions add distortions to someone's thought. Someone thinks about things that are not logical and are not real. They believe, they have a firm belief of some things that don't exist or not reality. So they are strong beliefs that misrepresent reality. For example, we have what you call delusions of grandeur, where somebody feels that, for example, they have a supernatural power, they can do supernatural things, or they can relate with supernatural beings, etc. Delusions of persecution. You want to believe that people want to persecute, harm you, amongst others. Now, perception disturbance is usually, when we talk about anything that is perceptual, it has to do with hallucinations. For example, we'll talk about a perception that has been disturbed. The way you feel, the way you hear, the way you smell, the way you, whatever, all this, when they are disturbed, we call those our perceptions. Someone may hear voices. That's what we call auditory hallucinations, for example. So, one of the positive symptoms is delusion. The second one is hallucination. I can see that in this slide, the hallucination is wrongly misplaced, but then it's what I am defining here. We have negative symptoms, and in negative symptoms, we have said that there are those that are removed from somebody's state of being. They diminish the brain's ability to process certain experiences and to respond to certain behaviors around the situation or environment. And of course, they can lead to many things. For example, flat affect, decreased motivation, inability to make goals, amongst others. So some of these symptoms are, for example, avolition, and this is when somebody is unable to initiate or persist in activities. We have what we also call alogia, and of course in alogia, we just mean that this person's speech is deterred and therefore poor communication. We also have what we call hedonia. They have no pleasure. They don't feel anything pleasurable to them, so they have no pleasure at all. And then we have what we call affect flattening, and this is where someone can't show emotions, and even the ability to smile, for example, is taken away. So literally they lack emotions. Other symptoms have to do with disorganized symptoms. And when we talk about disorganized symptoms, basically the disorganization could be in speech, it could be in behavior, amongst others. So one, the client may present with disorganized speech, they lack insight, they jump from one topic to another, they talk illogically, they, sometimes these ideas are not connected, amongst others. They could also present with inappropriate affect and disorganized behavior, like laugh for no reason or nothing really that is stimulating them to laugh, cry at improper times. People are eating meals and they're crying. Motor dysfunctions, for example, immobility, like they can be in one place for a long period of time, amongst others. Let's look at some of the schizophrenia types. We have the first one as the paranoid type, or paranoid schizophrenia. And every time the word paranoia comes in mind, you think about suspicion, mistrust, etc. Individuals with paranoid schizophrenia present with delusions. We already said delusions are these firm beliefs that have no basis. Hallucinations, where there is misinterpretation of perceptions. They also have issues in cognitive skills, the way they think. They always think people are there to harm them, people are there they mistrust people, they suspect people, amongst others. And of course, usually their affect is not affected much. However, in treatment of schizophrenia, this type of schizophrenia has a better prognosis. Individuals can easily manage it appropriately and well, as long as they support and are adhering to the drugs. The second type is disorganized type, and usually this type of schizophrenia is presented with disrupted speech, with disrupted behavior. They have delusions, hallucinations, affect is affected, and they have self-absorption. Then we have the catatonic type, whereby individuals of this subtype usually have motor disturbance. For example, you find them in one position, mute, for a long period of time. So this is what predominates catatonic type. And then they can reproduce sounds of other people that are producing, for example, echolalia. They can also have echopraxia. We have another subtype we call undifferentiated type. And of course, there are major symptoms of schizophrenia, but no particular one that is so specific, like say catatonic, disorganized, paranoid. Then we have residual type, and usually they experience at least one episode of schizophrenia, but no longer manifest major symptoms. So, what are we saying? That for paranoid, the main symptom here is the suspicion and mistrust. And of course, hallucinations and delusions, all of them, the content is more of, mistrust, suspicion of harm, etc. Disorganized, simply they're so disorganized the way they dress, the way they talk, the way they behave, everything looks very disorganized. Catatonic is more of motor disturbance and usually in one position, in many instances, doing nothing but just being there in one position, repeating sounds here and there, amongst others. Undifferentiated, they show various types of schizophrenia, but you cannot pin them to a specific or particular type of schizophrenia. The residual type, usually we're saying that they have at least one episode of schizophrenia, but they don't manifest major symptoms. You see, major symptoms are, for example, hallucinations and delusions. Now, when it comes to other psychotic disorders, we have the first subtype as schizophreniform disorder. And usually, they experience symptoms of schizophrenia, just, the symptoms of schizophrenia for a few months up to about 6 months. So that's what we call schizophreniform disorder. Schizoaffective disorder, they have the symptoms of schizophrenia, but also experience a mood disorder, a major mood disorder, for example, depression or bipolar. Delusional disorder, what is more key is that they have a persistent belief that is contrary to reality. You believe you are God. You believe you are the supernatural being, etc. And then, of course, onset is in mid or adulthood, around 40 to 49. Brief psychotic disorder, this type, individuals present with delusions, with hallucinations, with disorganized speech, but then they last for like 1 month. Then we have what we call shared psychotic disorder. In this one, a person develops a delusion similar to that of a person with whom or she shares a close relationship. So shared psychotic disorder is very interesting. So here means that this person usually presents symptoms similar to the person they live with. For example, this individual lives with a parent with psychotic disorder, and then now she presents with the same symptoms of that individual. This could be a daughter who is, say, for example, 30 years old, and the mother is, say, for example, 50 years old, and the mother has psychotic disorder, and then this lady now experiences similar symptoms of the mother. We've said up to around 1% of the population, and of course, for men and women, schizophrenia is equally in terms of population. Onset, usually early adulthood, late adolescence. Children develop later schizophrenia, that's why he's talking about late adolescence. But most of them usually present, as it begins in the early remission, they have less positive but more negative symptoms. Main cause is genetic predisposition, And a lot of studies have shown this as one of the main causes. Also, there's a lot of documentation indicates that dopamine system is too active in the people with schizophrenia, and some of them have enlargement of ventricle, some of them it could be because of viral infections, some of them it could be because of stress, but we say mostly it's genetic. Treatment, neuroleptic drugs do very well with people with schizophrenia. However, it is important to combine drug with psychotherapy, whereby clinicians teach on self-care training, and you've covered this in various courses. You also want to psychoeducate on social skills training. You also want to look at self-help groups. Prevention, especially with the family, you want to teach them, especially on medical adherence, support system, amongst others. Because if the family is not supportive or the environment is not supportive, it can be difficult to manage this. And we say that it is rarely cured completely. And the best is managing it, and with drugs, with support system, self-help groups, social skills learning, self-care, amongst others. So this is what we call schizophrenia. Thank you. Unless you have any question, write it down, and then I'll be able to respond to it. Thank you.